Had employer-based insurance, then lost her job. She went on Obamacare for $400 a month, then decided to take a chance.
And I need your help.
She ran for office and lost. Then, some really bad news. Cancer, stage 4 non-Hodgkin's lymphoma.
My prognosis is poor. I wasn't supposed to survive.
By that time, she couldn't afford insurance, qualifying for Medicaid. Wisconsin expanded its coverage under Obamacare, but rejected federal funds to pay for it.
Was it difficult to rely on the government for health care?
Well, not necessarily. It was life or death for me.
The American Cancer Society estimates today there are some 1.5 million Americans with cancer on Medicaid.
Anyone who's in the Medicaid expansion, who are really the lowest income Americans, and many of them are cancer patients as well, including childhood cancer patients, are going to be losers.
The Center on Budget and Policy Priorities estimates the GOP plan will gut more than $500 billion in federal Medicaid spending over a decade. For people like Tiffany Kaler with a pre-existing condition, her health care costs already over $1 million.
People have to be able to get to their doctors. People have to be able to get their medicine. And out of any country in the world, we should be doing it. We should be doing it right.
Now, the American Cancer Society has done some number crunchings on situations like Tiffany Kaler's in specific, and they say that she would pay about $1,000, perhaps even more, every month for health insurance. Under Obamacare, she was paying $400, so it would be much more, even though at the end of the year, she would get that tax credit. It looks like under this current Republican plan, it would cost her a lot more each month. Erin?
A lot more and far exceeding the proposed credits. Thank you very much, Miguel. Out front now, Republican Congressman Ron DeSantis, a member of the House Freedom Caucus, obviously in the center of all this, and many members of that caucus, of course, oppose the GOP Obamacare replacement plan. Good to have you with me, Congressman. I want to start with Tiffany's story that you just heard there, because, of course, the GOP House plan that we've seen does roll back the Medicaid expansion, and I know you think it doesn't quite do enough on that front. What do you say to Tiffany? I mean, she's a Republican, but you know, she wouldn't be alive. She wouldn't be here without that Medicaid expansion in Obamacare.
Well, if you remember when Obamacare was enacted, there were millions of people who had their health care canceled. And so there are stories of people who had certain needs, cancer or whatnot, who got pushed into policies that they didn't want, and then they didn't have the same coverage that they had because of the broken promise. So I think this law has really created a lot of different aspects. I would say, though, and the people who supported Obamacare used to make this point a lot before it passed, there really is no lack of health care. If people really need it and they show up at the emergency room, they do get care. It just gets passed on.
But she's had $1 million in cancer treatment. You're not going to get that by showing up in an emergency room.
Well, I would say this. The bottom line with Obamacare is a lot of the folks who are qualifying on the policies, on the exchanges, more people are leaving, insurers are leaving, so that's just not a sustainable system. You're not going to have that going on 2, 3, 4 years into the future if nothing is done. And so that's just the reality that we're dealing with here with this system.
So when I spoke to an expert from Standard & Poor's yesterday, and his view was the GOP plan would mean 6 to 10 million people on Medicaid would lose coverage under the GOP plan because of what it would do to the Medicaid expansion. When you say you wanted to go further, which I know you have said in your statement, what do you mean? You want to get rid of it altogether? What is your view of what should happen?